All right, hey there, my name is Trent Duncan, and I have two guests here today with me. We have Russ Scala from the Institute of Nutritional Medicine and Cardiovascular Research, and Julio Gonzalez, who is the National Military Liaison for the largest behavioral health company in the United States. Welcome, gentlemen. Thanks for coming on.
Pleasure.
All right. So let's get started. Let's jump right into it here. Russ, we're going to start with you.
Okay.
For anybody that's not familiar with you, and tell us a little bit about your history and dealing with rehabilitation centers and rehabilitation with the human body and the brain.
Well, actually, my history goes back to 1984 when I was on the SWAT team, and we had a large number of us drinking a lot and a couple of suicides, and I ended up getting attached to the critical incident stress debriefing team. So my interest in addictions and brain chemistry started in '84. So since that time, obviously, my training and my skills have evolved, partnering with research labs, and I've done focus groups with neurologists and work with military veterans, executives that came through our program on the wellness side, but then as we drilled down and tried to get them better, we found out they had a lot of addictions. So it seems like the higher stress the occupation, the more chance of them being addicted to something. And even the antidepressants are somewhat addictive to some people. So that being said, whether it's alcohol, opiates, or antidepressants, we developed a program to help people in high-stress occupations by looking at something that's never been done before. Our testing right now isn't offered anywhere, so I'm really excited about this program.
Good deal, yeah. And the thing about addictions, they span from anything from shopping all the way to drugs and food and alcohol.
Exactly.
So there's a lot of stuff out there. Okay, so there's a traditional rehabilitation model out there. Tell us why your model is a little bit different than what people can get when they just go to a traditional rehab center. Great
question. We work with methadone addicts, heroin addicts, people that were put on Subutex or Suboxone when they were actually going through withdrawals. And we were able to do blood work and interview them and their doctors and really look at them physiologically on what was going on. And we found that even at the best centers in the United States, there's some pieces of the puzzle that are missing. Nutrition, looking at the HPA axis, and let me explain that, the hypothalamus pituitary adrenal axis. Anytime that you're on an opiate or alcohol or you're addicted to a substance, you lower all the hormone levels in your body. Unless you rehab those hormone levels and get them back up functioning properly, it's not going to affect your brain chemistry. You need to rehab multiple systems of the body. 12-step programs have a history of only having a 25% success rate. So by us personalizing the addiction program and designing an aftercare program, and of course surrounding myself with research neurologists that kind of held my hand through the development of this, we feel that we could change the paradigm in addiction treatment and pain management.
Yeah. There's a lot of stuff out there that people are doing wrong, so it looks like you are on the right track.
Yeah, and we're customizing it, to the person, which, everybody's biochemically unique.
I know you preach a lot of that, so
yeah,
that's
right. I mean, we can't, one addiction program isn't going to work for everybody.
With us, we have Julio Gonzalez, who has a little bit of experience with rehabilitation centers and stuff. He's seen quite a bit of them. So I'll let you go ahead and tell the folks, give us your job title and then your experience with some of these rehab centers.
Well, once again, I'm glad to be here. My name is Julio Gonzalez once again, and I'm the National Military Liaison for one of the, if not the largest, behavioral health medicine hospital and company in the United States. So for the last 25 years, I've been working in the medical healthcare industry, out of which those 5 years I've been directly involved with the mental health industry and helping not only substance abuse, chemical dependency individuals, but also our military service members. So the last 5 years I've been working with as a military liaison in over 42 different military installations and 25 rehabilitation centers around the country.
Okay, 42 and 25, so that's quite a bit of number there.
That's a lot of traveling.
I understand, yeah, that is a lot of traveling. I understand you are kind of the liaison for the whole East Coast of the United States, is that correct?
That's correct. That's correct.
Okay, so you have a lot of influence and a lot of experience with a lot of these different centers and the different ways they work and stuff, correct?
Well, what it's like, Mr. Ross says, there is a gap, and that's what we, come here, through his program, that gap is closing. People are understanding a little bit better, what we do, and definitely I'm a strong believer of, what he's trying to get accomplished in our members. Service members right now need a lot of help. That's the reality.
So you have a lot of experience. Obviously, you wouldn't be here if you wasn't doing something right, huh?
Yes, sir.
Good deal. So let's jump back to you, Russ. I'm sure the folks are interested in your program and how it's a little different. So tell us what kind of testing you do that makes you different than just traditional rehab centers.
Well, one of the things that we did is when we had our focus groups and when we were doing our due diligence on addiction programs, we went all the way back to the 1940s and started studying the people that were really on the tip of the spear. And as you know, this is a competitive business market, and anybody that comes out with something new is shot down by traditional medicine. So I knew that was going to happen. So what we did is we gathered the data, the research, the double-blind studies. We videotaped post-traumatic stress patients, we videotaped brain injury patients, and we sat down and had focus groups with research neurologists. And along the way, we kind of figured that we were onto something. We were on the right track. So we closed the gap, as Julio said. We offer different types of blood work. We look at multiple metabolic markers in the body. We don't just have talk therapy, even though talk therapy is needed. We look at multiple systems and we're able to customize it. So it's evidence-based and it's gender-specific. You have to treat male and female addictions differently because their metabolism is different. So our testing is a little bit more advanced. We're able to use genetic testing, which is an amazing tool. The genetic testing is now affordable enough where we could align the medication directly to the patient. There'll be no drug interactions. They do the genetic test one time, and they could store that information, which can be accessed by any physician. So the medication can actually be customized to the person with the addiction with this genetic testing that we pull together. And the team that I pulled together is from MIT. They're 2 PhDs, and they're, again, wonderful, very, very sharp people.
Good deal. And I hear you have a little bit of a patent pending on some of that stuff, too, so that's your secret sauce, huh?
Well, you know, I learned along the way, dealing with business guys, that you get your stuff taken, and a handshake doesn't cut it. So we've got attorneys now to protect us, and we have a patent pending on this treatment protocol.
Good deal, good deal. So Julio, back to you real quick. Talk to us a little bit about what you've seen from Russ's program. Just tell us your thoughts on his program, and in a minute we'll get into how it compares with what you've seen out there.
Well, you know what, it's going through, and visiting all these centers and the military installation, definitely I can describe Russ's work in one single phrase, a very important phrase, is a complete paradigm shift. So through the use of advanced research, metabolic testing, hormonal testing, he has created specific protocols using metabolic marker for each individual person. So definitely we are working on something that is huge. Okay, we are not doing that. Okay, just to tell you the big difference here is that people are practicing right now, even in our facilities, blind medicine. So when he talks about genetic composition of the individual, this is a very unique approach, probably 15 or 20 years ahead of everybody else. Okay, so it's a complete paradigm shift.
Gotcha. That's some big words. Blind medicine right there, paradigm shift. Boy, so.
Yeah, I probably just upset half the United States with this program.
Those are some big words, and he would know. He's been all over. But real quick, just personally, how would you choose a rehab program? Because you work a lot with the military troops and stuff, and that's kind of your passion. So what do you look for in a rehabilitation program when you visit all these centers?
Well, one of the things that we look for is I am looking for a professional team of individuals that really know and are passionate about, the well-being of our members. When we talk about service member, we talk about not only the service member, we talk about their families. Mm-hmm. So, there's a lot, to take care of. And in doing that and thinking about that, we will never send a service member to any of our facilities if I don't feel like it's like treating a family member. Also because people are unique in their composition and genetic composition. This uniqueness makes things very strong point to what kind of facility I'm going to direct that service member or that family member. So we're going back again to genetic composition of the individual. We're coming to paradigm shift in healthcare. So we're very excited about it. We're very excited. Yeah.
So the facility that offers that is going to be definitely on the cutting edge, huh? I understand that you guys have your program into a Newbridge facility is where you're starting your program. Tell us a little bit about that.
Yeah, that was really interesting. Right here in my hometown in Winter Park, my medical director and friend Sergio Menendez had a friend named Arthur Wright that was the founder of Newbridge Recovery and Wellness Center. And I've had numerous meetings with Art here in Winter Park, and we're brainstorming on developing this program out of that facility. So that's going to be ground zero for this paradigm shift we're talking about. They're a very savvy group of people. The facility, Julio and I toured it, it's very high end. And because I traveled around the Florida market to different centers with clients, I know there isn't another facility like this anywhere. So hopefully as this evolves, we'll be able to do something really unique out of the Newbridge Recovery Center in Winter Park.
So it's my understanding from what you're telling me is that a lot of this rehabilitation starts in the brain. And you have a couple of, like a brain injury patient, rehabilitation patient, I'm sorry, a PTSD patient as well too. Tell us a little bit about them.
Yeah, one of the things we did, like I said, because I was on the SWAT team in '84 and I was dealing with a lot of these same issues myself with bad dreams and drinking a lot, whether it's PTSD, Ricky Zabalo, or Louis Amabile, the brain injury patient that we're in the process of rehabbing, they just tell it like it is. You know, they say, I didn't have anything but medication, and I had no aftercare program. They're just speaking from the heart. And they say that the medical community dropped the ball on them when we came in and picked the ball up and did the advanced testing and took care of it and documented everything. Because, like I say, medicine is a business. Everybody's got their heads down. They're just like in competition, whether it's Blockbusters or Netflix. That's how medicine is, and it's sad. All right? So me knowing that is, I'm going to have to document everything because people are going to shoot us down from all over about this program. So that's why the blood work that we've done, the nutritional testing, the videotaping, the brain imagery, the focus groups that we had, we're ready.
It all speaks volumes, huh? Wow. Explain how RX development falls into this equation here and how they play a role in the Newbridge facility that you guys have started out.
Well, one of the interesting things about meeting new business partners that come through your program, the owners of RX Development, they're I think a $40 million company, and they're in 13 states. They have 700 physicians where they set up dispensaries for pharmaceutical distribution. They're in the pain management business. Well, obviously, I got to know the two owners, and we were brainstorming on ideas. And in the pain management business, obviously, when they put people on pain medication, you got to be careful they don't get addicted, right? So I see the pain management doctors as letting their patients know that there's other testing available, that once you come off this pain management medication and you're free of the pain management medication, then we could rehab your body. So by talking with the owners of RX Development, and they actually put me in front of a lot of their physicians, those physicians sent me blood work. They talked about patients. I brainstormed on a lot of ideas, collected a lot of data. And they would be a great distribution channel for this program, or the pain management market, because anytime you put somebody on a pain medicine, you're causing damage to their body. Even though they're going to need the pain medicine, it's only a bridge to get them to be well. Well, if you put them on the pain management program, or whether it's oxycodone or whether it's Suboxone going through withdrawals, you have to monitor multiple systems of the body so you don't cause any damage to them. So that's another market that Julio and I see that we could go after with our reps.
Well, it sounds like you got a long road ahead of you, but you have all the research and stuff to help back it up, which is always good. So if anybody wants to get a hold of these fellas here, Russ, Institute of Nutritional Medicine and Cardiovascular Research, and then Julio Gonzalez, you guys are working together here. All right, thanks for coming out here, gentlemen. All right, appreciate it.
Okay.